we have been doing an in vivo study where we looked at sentinel lymph nodes in rats. And as mentioned before, in this conference, it's important to find a sentinel lymph node because breast cancer malignant melanoma spreads mainly through the lymphatic system. And if the cancer is spread, it's most likely to find cancer infiltration in the sentinel lymph node, because that is the first regional lymph node that drains the tumor. So to obtain a good diagnosis, it's important to find the sentinel lymph node. And for most imaging technologies, the development in contrast agents goes towards molecular imaging, but there are some limitations with ultrasound. There's low contrast resolution, and also the commercial contrast agents used today is confined to the intravascular system. So to overcome these limitations, there has been development of new contrast agents and also new ultrasound imaging techniques. And one such contrast agents is superparamagnetic iron oxide nanoparticles. And those particles are small enough to be used for molecular imaging. And by labeling them with appropriate markers, they can also be used for multimodal imaging. And then you can combine the best property of the different imaging modalities. And in our case, you can get a better identification and localization of the sentinel lymph node. And you can see an example down here where you can use a pre-treatment of PET and MRI, and then you can use ultrasound as a bedside guidance during surgery. And this is the setup. We have in our case, we have a rat, which we inject with particles. So the main principle of magnetomotive ultrasound is that you apply a time-varying magnetic field, and then the particles will start to move. And when they move, their surrounding will move, and this movement can be detected with the ultrasound scanner. And we have developed an algorithm which tracks this movement. We apply 5 Hz signal to the 5 Hz magnetic field. And then this algorithm, it tracks the phase variation of the IQ data in each pixel through all frames. And it's based on quadrature detection and phase gating at the precise frequency of the nanoparticle displacement. And in this way, we can sort out all the other movement at other frequencies. And then we do a color coding in regard to displacement, and so which we superimpose on the beam mode image to indicate where the particles are. And previously, we have done an in situ study where we have combined MRI with magnetomotive ultrasound. So we have an MRI image up here, and down here we have a magnetomotive ultrasound image. But in this study, our aim was to verify if it was possible to do this in vivo. So we had 3 different rats, 3 Wistar rats, which were injected in the right hind paw with 100 microliter nanoparticle solution, and it was given in 3 different concentrations: 0.1, 0.2, and 0.3 milligram iron per milliliter. And this is within the range of the MRI contrast agents used today in the clinic. And after 24 hours, the sentinel lymph node in the rat's right knee were imaged with the magnetomotive setup. And we had a 5 Hz signal, and we varied the voltage in between 5 and 60 in steps of 5. And we also took 6 different cross-sections at the highest voltage, 5 Hz. It disappeared?
Yes.
No? At 5 Hz, 60 volts, 6 different cross-sections to look at the distribution of particles in the sentinel lymph node. And then we did the scanning time, we made it as short as possible to avoid any heating. So to evaluate, we did some displacement measurements. First we outlined the sentinel lymph node in the beam mode image, and then we looked at each pixel and calculated the magnetomotive displacement in each pixel. And then we did an average of all the pixels in the lymph node, which should represent the lymph node movement. And we also calculated signal to clutter ratios. And we defined it as average magnetomotive displacement in the sentinel lymph node divided with the average magnetomotive displacement in the rest of the ultrasound image. And here's one example. We have our B mode image, and we have our sentinel lymph node and surrounding fat capsule. And here is the movie. You can see it's moving in this area, and this is the artery. It's pulsating. Here we have the sentinel lymph node. So again, we have the B mode image, and here we look at all frequencies and all phases. So we can see the lymph node, but we can see this area, and this is the artery, which stands for the high motion, because it's color-coded in regard to motion. And when we apply our algorithm and only look at 5 Hertz, so then we get this image, the magnetomotive ultrasound image, and you can see that it's clearly pinpoints where the particles are. And you can also note that it's a more than 150 times difference between the maximum displacement in these images. So we increased the voltage also, and here is one example. We have 10, 20, 30, 40, 50, 60 volts. And you can see as we increase the voltage, and thereby also the magnetic field, we increase the magnetomotive signal. And the same tendency can be seen in all rats. Here we have excitation voltage on the x-axis, the average displacement in the sentinel lymph node on the y-axis, and the colors is the different rats. So the same tendency is seen in all rats. If we increase the voltage, we increase the displacement. So we looked at the distribution in the nanoparticles in the sentinel lymph node as well. We have 6 different cross-sections, 3 vertical and 3 horizontal. And here we have the cross-sections on the x-axis, the average displacement in the sentinel lymph node on the y-axis. And you can see that the displacement, it varies not only in between the different rats, but also in the different sentinel lymph nodes in the rats. So it indicates that there is an uneven distribution in the sentinel lymph node of the particles. And this is this is the high concentration rat. You can see this distribution, like in cross-section 3 there is nearly no movement, but in cross-section 5 there's a lot of movement. And then when we look at the animal 2, we have a more even distribution of the particles throughout the lymph node. And finally, we looked at signal to clutter ratios. We have voltage on the x-axis, signal to clutter ratio on the y-axis. And in the beginning, the signal to clutter ratios increases with voltage, but after a while, it stabilizes, and it's around 20 to 30 volts. And we think that's some kind of threshold value where all the nanoparticles are set in detectable motion. And above those voltages, we guess that there is only an increase in movement. As you can see here, the same images that has been shown before. And we have 10 volts and 60 volts, so the signal is increased inside the lymph node and then also outside of the lymph node. And as we define the signal to clutter ratio as the average magnetomotive displacement in the lymph node divided with the average magnetomotive displacement outside of the lymph node in the rest of the ultrasound image, they probably contribute in an equal way. So in this study we have shown that it's possible to detect nanoparticle laden sentinel lymph nodes in rats, and we have done it in vivo. And even though there has been large motion artifacts, we are able to sort out the magnetomotive signal and give a clear representation where the particles is. And this opens up the ability for future use of the technique in the clinic in the future. Thank you.